Hello, everyone. Hello. Good morning, good afternoon, good evening from Digital Health Africa and Academic. As you can tell, we are really thrilled and proud and excited to be here on session number 5 of the AI in Healthcare webinar series. Today is going to be just a little bit different because it's our session finale, but as usual, there will be enormous value in the space of AI in healthcare that we will be bringing to you today. We have a very exciting guest who has done a lot of things and who is willing to share with us some case studies in AI in healthcare. So we hope that you look forward to that. While we stroll around and wait for others to join us, as usual, say hi in the chat. Thank you, Hussein. You already know the drill. Just say hi in the chat, tell us your name and what country you're from. And please do add if you have attended all 5 sessions. Just let us know if this is your 5th session. Hi, Teddy. Thank you so much. Yeah, I mean, at this point, some names are actually familiar because we've been seeing one another. So for those who are joining us for the first time, if this is the first webinar you're attending, Digital Health Africa in partnership with Acadic over the last 5 weeks we have been hosting an AI in healthcare webinar series, and today is the 5th session. We don't want to brag, but we can tell that we have been able to deliver some impact, some value based on the feedback from our audience. We had session 1, which was on the overview of AI in healthcare by Dr. Mustafa, and then session 2 on the basics of machine learning by Dr. Julius Odonuga. And then Dr. George Obaido took us through introduction to healthcare data. And last week, Professor Udano Collins thrilled us on healthcare predictive modeling. It was just wow. So today, as a capstone to all of that, we have a very special guest whose name I'll tell you guys in a bit, who will be taking us on case studies of AI applications in healthcare. Thank you, Rodney. Rodney, I know your name by now, right? So thank you for joining us. Hi, Divya from the UK, Rachel from the US. Hello, Peter from Nigeria. We're so happy to see that we're having a lot of repeat attendees, which we're probably doing something good. Thank you, guys. We would wait on for a couple more minutes and then we'll start at exactly 4 p.m. West African time, sorry. Hello, Elizabeth from Uganda. Thank you for joining us today. We hope that you are excited because Jeremiah has some really wild case studies for us today, actually. And just as a note, every one of the 4 former webinar sessions that we have had is available on our YouTube at Digital Health Africa. If you go there, you'll see every one of those sessions. If you just want to catch up, if you want to you can visit there as well. Hello, Chidebere from Nigeria. Good evening. Thank you for joining us. Brian from Kenya. Just 1 more minute, and then we will dive in. Hello, Dakum. In just a minute, we will officially be starting. So we will not be introducing Digital Health Africa or Acadic in detail because we did that in our first session. But just as a way of speaking, these are 2 organizations. Digital Health Africa is based in Africa and Acadic is headquartered in Canada. And these are both organizations that are dedicated to pushing forward the digital health agenda in Africa. And this webinar series has been brought to you by both of them. So yes, it is 5 minutes past 4 and we would like to start officially. In just a minute, you would see the slide that gives you a little bit of a recap about our guest, whom we're very proud to introduce. Like I said earlier, this is session 5 and the final session of the AI in Healthcare webinar series that is brought to you by Digital Health Africa in partnership with Acadic. You're very welcome. We are glad to have you. And as usual, we have prepared and we have done everything possible to make sure that we're bringing you the best.
Yes, I can see that. All right.
Right. So, leading us today to deliver the value we usually bring is our highly esteemed speaker. Jeremiah Olamijuwon is an innovator, is an entrepreneur, and is a tech advocate who has been doing a lot to drive positive change in Africa, especially in the tech space. He has a track record of founding successful ventures, including Atihuku and Kunes Proprietary Limited. Jeremiah has embarked on various initiatives such as utilizing missing persons, detecting diseases via retinal imaging. Of course, that's in the field of AI in healthcare, as well as identifying emotional breakdowns on social media. So you see how versatile his experience and skill set is. Just outside of entrepreneurship, he champions inclusive growth, advocating for policies that support entrepreneurship and collaborates with stakeholders to create a conducive ecosystem for business development. So now this is looking all formal and all, but besides all of this, I had Jeremiah is just another young person like the rest of us who is committed to realizing change in the space of AI and particularly in the field of healthcare. So Jeremiah, we are extremely privileged to have you, and we want to say thank you for joining us. And yeah, over to you. Our audience is waiting to hear what you have for us today.
Right. Yeah, thank you very much. I'm very excited to be here. Right. Hi again, everyone. I'll just share my screen in just a little while. Okay, so this is the 5th session of the AI Healthcare webinar series. But then also I know some actually likely joined, a little bit halfway in, and some are probably joining for the first time as well. But once again, yes, I'm Jeremiah Olamijuwon, and I'm a tech advocate. I love artificial intelligence. I actually specialize in artificial intelligence aside from founding companies, if you would say. Okay, and basically what I would do for the first few minutes is I'll break down again what exactly is artificial intelligence. What exactly is it? When we say AI and healthcare, what exactly are we talking about? So everyone actually saying artificial intelligence, machine learning, artificial intelligence, it's going to take over the world. We're going to get into some apocalypse, and basically everyone is scared, some are excited, and all of that. But then what exactly is artificial intelligence? In simple terms, artificial intelligence is the ability of a machine to do what would require a human being to use intelligence to do. Right. So basically, artificial intelligence is not necessarily what maybe you say walking. Even a goat, for example, can walk and navigate its way, but something which requires some more level of intelligence, and a machine is able to do that task. That's what we call artificial intelligence. And generally now in the context of healthcare, I want you to imagine Ben Carson, right? Imagine a medical doctor, and then you have a machine which is just made up of some metal, some alloys, whatever, and also some software in it, the same way you have your computer. But that same machine is able to do exactly what the medical doctor who has been trained for years is able to do, right? And that's basically what we mean by artificial intelligence. So in today's session, I would actually be walking you through some case studies of artificial intelligence in healthcare. But before we actually go into some of those case studies, sometime in 1950, there was a man called Alan Turing. And, there was a question: how do we exactly know when a machine is intelligent, right? For example, is a calculator intelligent? It's a machine. Is a car intelligent? Is an electric pump, for example, is it intelligent? How exactly do we define intelligence? How do we really say a system is intelligent. And basically, Alan Turing came up with a test that says you would be able to say a machine is intelligent if you put a system or a machine in a particular room, and then you put a human being, an expert, in another room. And then there is a neutral observer who doesn't know anything about those rooms. Now, that neutral observer is able to interact with the entity in room A and the entity in room B. Now, Alan Turing says you would be able to say that machine is intelligent if at the end of the day, the observer, the neutral, the investigator, the interrogator, if that interrogator is not able to really tell the machine apart from the human, right? So, which basically means you interact with those two entities and they're responding to you, and the responses are so coherent such that you cannot exactly tell if there is really a machine somewhere or if there's a human somewhere. You really can't actually like tell the difference, right? And now in that picture there, you would actually basically see some, should I say, AI generated image of Ben Carson, who is famous for separating the conjoined twins. And then on the other side, you have some other conjoined twins by the head as well, who are being operated on by, some artificial intelligence systems. Generally, we would call them robots, but I would just call them generally artificial intelligence systems. And the reason why I say that as well is it's not all artificial intelligence that actually takes the form of a humanoid robot. They could actually like be, they could take some other forms as well, right? But then think of you having two surgical rooms. You have Ben Carson, the most skilled or one of the most skilled, surgeons in the world, who operated on the conjoined twins. And on the other side, you have some robots as well. Now, at the end of the day, you basically check the result of the surgical procedure. And if we're not able to tell which ones were operated on by that super skilled, best surgical doctor in the world, from the artificial intelligence systems, you can say that that system has attained intelligence, all right? And that's what we basically call the Alan Turing test of intelligence, right? Now, it is very important to actually mention, right? An AI machine is not just another machine, right? For example, here you would actually see a picture of a car with a driver, right? That car is made up of a whole lot of parts. You have the engines, you have the fuel pump, you have the tires and all, but it is not an intelligent system. It is not an intelligent machine. And then on the upper side, you'd see another car. Now, let's just assume that this car is able to, besides the normal usual function of a normal mechanical parts that are joined together, this car is able to do some intelligent tasks like stopping, driving itself, applying brakes, able to like put directions whenever necessary, able to calculate disaster, able to calculate brake sequences, etc. These are things you would generally expect a human being to be able to do. And not just any human being, that human being also needs to be trained on how to drive a car, right? So now, if you then have a self-driving car, it is no longer just some parts that are put together. It is now an intelligent system. Okay, so we basically then when we talk about artificial intelligence systems, we're talking about some couple of systems that run on some sort of operating system as well, or some sort of software that helps them to be able to navigate. They're able to make more informed decisions. They also can provide recommendations as well. So let's just dive a little right into some case studies, and I'll be giving you some real-world case studies of how artificial intelligence has been applied to healthcare. And of course, by all means, I'm going to start with one of our projects, which we working on at Etioku, which is called Views. All right, it's called Views. It's basically an eye care platform, and you'll see there one of our partners right there is staring right into that small device, and we're able to take a retina image scan, of your eye, and analyze it for a whole lot of diseases and health statuses. For example, it would be able to tell you if you have hypertension just by taking a retina image scan. It will be able to tell you how old you are, whether you're a smoker, whether you have diabetes, whether you are hypertensive, and a whole lot of other things as well. All right. Now, this is basically artificial intelligence able to take just an image and analyze patterns in that image to make some sort of conclusion and diagnosis. All right. So how does this actually work? How does this work? Basically, it's all about, call it computer vision, when you're dealing with intelligence tasks that really require images. All right. Beyond image processing, you take the image and then you look at the patterns in that image. For example, if I were to sort everyone right now, listening to me, to say, A, go here, B, go here, you go to A, you go to B, you go to A, you go to B. As a human being, you start forming some sort of judgment or a bias. Why is this sorting them into two groups? Is there a reason he's sorting them? Now you start trying to form some sort of bias in your mind. Could it be he's separating based on nationality, based on ethnicity? Could it be based on gender? So you start trying to look at those groups, right? And you start trying to analyze what is actually similar to those people and what is similar to the people in the other group as well. And once you have now formed a bias, it simply means by the time I call the next person, almost subconsciously, you can tell where I would assign that person to, right? And this is basically also how artificial intelligence works. The only thing is the human being cannot think beyond 3 dimensions, right? So, which means you can only combine some number of possibilities together to say, oh, I see. So he is slightly tall and she also is slightly tall. And they are in the same group. So it cannot be gender. What are some other similar features? Oh, I can actually tell based on the accent, oh, this is from Europe, but this seems more like from Africa. This seems more like from some North America, for example. But then again, you throw another item in or another person in, and you now start saying, oh, wait. But then this same person actually has a similar accent to, let me say, Africans, for example, and yet the other 2 people actually have some sort of European accent. Okay, so no, this couldn't be based on accent. So you start trying to find those patterns in those group of people, and then also you try to find the pattern in the other group as well. But again, you can imagine if you have to combine like 100 features, and by features, I mean, let me say descriptors, right? You have to like combine 100 of those in your mind just to actually be able to make a decision. You'd actually start seeing that it gets more and more and more and more complex. And this is where artificial intelligence comes in. So we're making artificial intelligence simulate how a human being thinks, right? So combines those patterns of data, combines the pattern and says, oh, I can actually sense, I can see that these are quite similar, and these ones are similar as well, even though there may be a few ones that are not necessarily like the others. We call those outliers. Okay, so, but then at the end of the day, by forming some sort of bias, the artificial intelligence is able to make decisions in the future. Okay, so now, when we talk about views now, how does it work? Again, like I said, computer vision to analyze patterns in the images and then use the bias formed by studying those patterns to sort them into different diseases or health status, for example. Another thing also that then views does is having generated some sort of classification, or having sorted this data into groups, all right, your eye scan, it is able to like analyze the patterns and say, here are some of the things I can spot. Views uses natural language processing to generate some sort of results, all right? So you can imagine a doctor, for example, the doctor is asking you questions. Oh, do you have a headache? Oh, yes, I have a headache. Okay. Stomach pain as well? Yes, I have a stomach pain. Are you feeling dizzy? Yes, I'm feeling dizzy as well. Oh, are you drowsy as well? Oh, yes, I'm drowsy. Then they take those notes. Now, when they take those notes, the doctor now sits down, combines all of those decisions, and makes even a more informed decision. They will produce something called, for example, something called doctor's notes or medical notes, right? And then they actually like write a whole lot. Based on those notes, the doctor as well can make recommendations to say, these are some of the things you should start doing, or some of the things you should stop as well, right? And this is the same thing artificial intelligence does. Now, in generating those texts, processing those texts, understanding those texts, is what we call the natural language processing. So it actually tries to understand human textual data, tries to understand that data, and then tries to make sense of it. And by making sense of it, it also generates some other results as well, which in this case basically can be recommendations, all right? Another case study again from Etioko as well, interesting, is it's also another natural language processing product. We call it Afya Kalos, which is basically a combination of a name in Swahili and another name as well from, I'm not sure it's Latin or so, which basically means good health, right? And this is basically a social media personality, which actually like just stays there on Twitter, is looking out for people who are struggling or who are having some sort of, right? So I can see, oh, this person is actually just joking around. Nah, this is joking around. Oh, but then someone actually simply just posted something. A lion does not concern himself with the opinion of a sheep, right? Game of Thrones. And then the ability to actually understand that this is not just a mere quote, or this is not just a mere picture that someone has just posted. By actually studying the user behavior, their posts over time, and actually it sees, this person is actually feeling betrayed, or this person is feeling angry that some people, are speaking behind them, right? And this is basically artificial intelligence, all making this bias, making this judgment. The same way, for example, you as a person scrolling through some feeds will see certain posts. You may misunderstand the context of the post as well, the same way an artificial intelligence system can misunderstand the context as well. All right, so basically then it analyzes and says, oh, I see. This person is feeling so sad. This person is feeling down. This person is feeling betrayed. So what does it do? It then tries to engage and say, oh, you know what? I understand that sometimes, people can speak behind you, but you know what? Hey, chin up. Don't worry, just ignore the past. Or, give some sort of empathetic words. What has actually happened there? Artificial intelligence, especially if you upload a picture of that quote, has used computer vision, optical character recognition to extract the text from that image, then pushes it through some natural language processing algorithms. You have a whole lot of large language models, especially these days. Many of you might have actually interacted with ChatGPT powered by OpenAI, Anthropic Cloud, Mistral, etc., right? But basically, it passes that text now through some sort of large language model, or even it could be a small model, could be something that is specifically trained for that particular task, right? And then it pushes it through that model. That model needs to actually understand the context of this particular quote, because it could simply just be a quote I just lifted from Game of Thrones. So it needs to take into context the previous user behavior as well. And then after understanding the context, it then actually can converse with a person by actually offering sympathetic words. All right. Another interesting case study is your Google DeepMind and Moorfields Eye Hospital. And this very much also works like views as well. And Google actually has gone a whole lot far, in ophthalmology. and they basically also take your retina scans, your eye scans, and they are able to identify over 50 eye diseases. Now, slightly different from Views, right? Views actually tries to check your entire health status, but Google DeepMind actually zooms in more to actually see, oh, this person has some cataracts, or this person is short-sighted, or has some sort of myopia, or something like that, basically. So it analyzes the eye image. So instead of you having to go, for example, to an ophthalmologist, you simply can actually like use the artificial intelligence system that Google has built and actually like try to check if you have any eye disease at all. Interesting, right? That's exciting. And one thing Google has actually like done, Google DeepMind, is they partnered with an hospital. Again, how does this work? I know already you can tell in your mind that obviously we have to take some retina scans or some eye scans, and we have to analyze the patterns in the image. This is simply basically some sort of image classification. Could be multiple image classification as well, in the sense that it may not just be one disease, but by analyzing the small pixels that make up the image, by analyzing each of those pixels, you can imagine a picture of about, let's say, 1028 by 820 dimension, and it actually has to analyze each of those pixels to see if there is any pattern of an eye disease. That is basically computer vision at work, right? And then beyond that as well, it then generates some sort of doctor or ophthalmologist reports, right? To say, oh, Jeremiah is having some sort of cataract, which is in stage 2, for example. And in order to do this, it needs to get some lenses that are this particular measure so that it can correct that. Failure to actually like use a correction glass in about 2 months, for example, could lead to further damages, right? This is what, again, an ophthalmologist, a human ophthalmologist, would do. Now, I know I'm taking you through a whole lot of case studies of AI in healthcare, real life ones, but I'm going to tell you a little bit more later as to how exactly this actually works. All right. Another interesting one is the pathology AI, the Path AI. This is also another interesting use case, and Path AI is focused on detecting cancerous cells, right? And also, doing this at a very high accuracy, well, good accuracy. And of course, the good thing, which I'm going to show the next one, which is also with cancer as well, is that the ability to analyze some mammography scans, some PET scans, some MRI images, or some X-ray. Just imagine you go to the doctor and then you take the X-ray scan of your chest. All right. You want to actually hear, oh, do I have tuberculosis, or do I have, any disease, for example? The ability to analyze each of those pixels and see if there is a pattern. Right. Now, basically what your doctor would actually do is they would study that image, look closely, and then try to form some sort of bias sort of decision to say, I think Jeremiah might not have tuberculosis, but then it seems that there's something interesting that does not really seem normal, right? We may not know that. And this is actually where artificial intelligence, again, can come in. By being trained on a whole lot of diseases, on a whole lot of cancerous categories or something, the artificial intelligence can even tell that you are about to have cancer, right? If there is a way the image actually evolves, right? So which means you could even use artificial intelligence to detect early stages of cancer. So then it doesn't have to actually grow beyond that particular stage. Another interesting one, and this actually works well with Path AI, and this is the IBM Watson. Many of you know IBM, but IBM actually has the IBM Watson for oncology, and now this is used to treat cancer, all right, or recommend treatments for cancer. So you can imagine you go to Path AI, you go check, oh, do I have cancer? Well, kind of cancer of the lungs, but then otherwise everything is good. And then you go to IBM Watson for oncology and you say, they said I'm in stage 2 level of cancer, for example, lung cancer. Can you tell me what I can do? What's the next step? And interestingly, the IBM Watson Oncology, according to a report, actually says that the diagnostic accuracy is about 90%. And that is actually like way, way, way more than your usual about 50%, which is almost chancy, that human physicians would actually like use to detect, right? And that's quite interesting. And again, how does this work again? Studying the patterns in the images, generating classification, and actually saying this is in a stage 1 level of cancer or stage 2 level of cancer, or this is in the maximum level of cancer, for example, and this is what needs to be done, recommending chemotherapy or some other forms of treatment that may be possible. And the interesting thing about this is, by being trained on so many other scenarios in the past, it is less prone to the human mistakes a doctor may make, subject to maybe their mood at that point in time or some other human factors as well. Another interesting one, Babylon Health. And this one basically, it's an AI-driven telemedicine and health service. So basically, instead of you having to go to the hospital every single time, especially like in Africa, where there's a shortage of health practitioners, to like wait a whole lot of time to see a doctor. Why not consult an artificial intelligence doctor who is able to ask you relevant questions to say, hey, doctor, or Dr. Babylon, I am having headache. And they say, oh, I see. Any other symptom? It's able to converse with you. And based on the responses you give to it, it's able to lead you down specific, other specific questions that can help it make more informed decisions, right? Or say, oh, okay, you just having a headache. Have you been looking at the laptop for a long time? Oh, well, I work on the laptop on average of about 12 hours a day. I see, okay. And then how often does this headache occur? Oh, it occurs 2 times a day. And it starts asking you some other questions that could help it make a decision to say, oh, you know what? Maybe just take a break from the computer, or just use some medicine and you would be fine, right? Of course, at the stage where artificial intelligence is, as of today, it is important to know that there's still some guidance that is required for many telemedicine AI systems, right? So those are some of the cool case studies. But again, now you're probably excited, you want to do something cool in healthcare. So what are some of the things you can do in healthcare? Some interesting projects you can embark on. Well, one is the AI-driven prediction and monitoring, epidemic prediction and monitoring. Now, just imagine a world where you can preempt or predict COVID-19 before it starts. Then we don't have to all be locked home, right? We don't have to all be under lockdown, because by predicting it, we can also predict its severity. We can predict even the genetic sequence, right? And we can even build vaccines ahead of time for that disease. And interestingly, I would say that when the COVID-19 broke out, they required like a lot of AI enthusiasts like myself as well, who quickly went to gather some sort of data, and we're trying to see, making some sort of permutations, combinations, trying to train AI system to kind of predict what kind of medicine can be used, what kind of vaccine can be used. I have no doubt that one of the ways the physicians or the doctors or the laboratory scientists have been able to come to a quicker solution for the COVID compared to hundreds of years ago, or about 100 years ago, where there was another outbreak. A lot of people actually say, oh, no, you know what, there's some sort of conspiracy theory here. How did they arrive at the vaccine so immediate, right? But again, the use of artificial intelligence can speed up that process, such that our artificial intelligence system is able to analyze the genomic sequence of this virus or a bacteria, and is able to check its how it is evolving, and then we can build something that can combat it based on all the other vaccines that have been built in the past as well. Right. Another one is an automated data analysis, health analysis for resource allocation. Imagine developing continents like Africa, where you need to be able to allocate healthcare resources. You could do this for your government to say, some funding may be needed more in this particular hospital. We may need to deploy more resources, health resources, more physicians to a particular hospital, because there tends to be maybe more patients. And not just more patients, you also want to like allocate some other resources as well. Maybe allocate even recommend a doctor's time, right? To say, Dr. Ben Carson, you are the most skilled surgical surgeon in the world. Perhaps maybe you should rather be in South Africa in the next week, because we can tell that there would actually like be maybe some patients that would need more of your attention there, right? And so basically you use the artificial intelligence to kind of allocate resources, whether human resources or non-human resources as well. That's another cool thing you could do. Another thing you could do is a local language, natural language processing for patient interaction. Now, this may seem, actually, because language translation has been done over and over. But if you look closely, you would see that language translation has only been very well done for high-resource languages, not for low-resource languages. So, for example, you have some languages in Africa that have not really been well catered to, or probably not even catered to at all. You want to build something that allows Africans, for example, to be able to speak their language to this artificial intelligence system. And even beyond that, you also want to probably even be able to detect accents as well, and be able to understand accents, right? For example, someone from West Africa may have a different accent to someone from East Africa, may have a totally different accent to a British, right? And have a totally different accent to an American, for example. So that's another thing you can do, such that the people in your local community can also benefit from artificial intelligence. Another thing also is the AI for maternal and child health monitoring. If you're someone who is very keen on, the child to mother relationship, what you could do is you could look at helping pregnant mothers to track the status of the child based on the mother's behavior. For example, eating behavior, exercise behavior, maybe alcohol consumption, and so many other things. For example, maybe at some point they must have fallen, and if they fell, for example, what could be the status of the child? And you could be reforming a whole lot of the prenatal and possibly even the postnatal environment of the health sector. Another one also is the drug resistance tracking. And this is quite interesting, especially because some of you have probably taken some pain reliefs at some point, and the more you use that pain relief, it suddenly becomes ineffective. You've become resistant to that particular medicine, right? So you want to really track, for example, when a drug or a medicine is effective. You want to check if, for example, a patient you are tending to is already resistant to the medicine, and maybe you need to provide another medicine, for example, to them. All right, I will pause here, and I would actually like just have one person give us just one more cool project you think you can do in healthcare. Anyone? Okay, no one. All right, so I am going to move on then quickly, and that's so how exactly does this whole AI thing work? Well, I mean, everyone says AI. Yes?
We do have comments in the chat, yeah, as a
Oh,
response. So yeah, we have
okay.
Divya saying heart attack detection from ECGs, and Dami saying tracking of disease outbreaks, and Rosalind says heart disease prevention as more applications of healthcare, like you asked. Applications of
That's
AI in
brilliant.
healthcare, like you asked.
Yeah, thank you very much for bringing my attention to that. That's brilliant. Yeah, the electrocardiography. Interestingly, a few years ago, I was working on drowsiness detection, and we have to like take signals using the ECG, the electrocardiogram as well, and basically sending the sensors to detect if a driver is drowsy. And it's a very, very cool project you can work on. Very, very still much applicable. Disease outbreak tracking, again, like we mentioned, the heart disease prevention as well. And all of these things, you only need someone who is already skilled in this area. Just sit with them, understand the domain of that aspect you want to solve, right? So for example, you want to see a cardiologist for an heart disease prevention, understand what exactly could lead to heart diseases, understand how can it be prevented, and then you train your artificial intelligence on that scenario or that data. But again, I'll get there in a short while. Health facility inventory prediction. I see a whole lot of people actually are typing some cool applications out there. I love that. Okay, so how does it work? You gather your data. So just imagine, for example, you want to tell whether or not someone has cancer. So gather data of people who have cancer. All right. And then gather data, for example, of people who don't have cancer. Now, you may not be able to see the differences, but I can assure you a system that analyzes every single little bit of an image may be able to tell the difference eventually. So what it does is it looks out for the pattern. Again, we'll get there, right? But again, the first step is collect the data. So you want to prevent heart diseases, for example. You want to collect data of things that can lead to heart diseases, for example. You want to like get how, for example, it would be prevented generally, right? Maybe relating to a particular course as well. So you gather all of this data, also gather some other negative scenarios as well, and then expose your model to that. We'll get there quickly. And then also we have data cleaning as well. Data cleaning, so now you have this huge image, but also you don't necessarily want to pass the huge image as well. So you want to make your model maybe zoom in a little bit more into that particular image, all right? In features engineering, there are some things we call the principal component analysis or the SVG as well, which is more of dimensionality reduction. You don't have a whole lot of resources, but also you want to train your model. So you're trying to kind of like compress the dimension. That's one of the features engineering we have. There are a whole lot of feature engineering techniques we have as well. But the goal of this exercise is to make sure that your data is suitable for your model and also the resources which you're working on. Then, of course, the big part comes, the machine learning algorithms. So you want to pick up some machine learning algorithms, some convolutional neural network, or some recurrent neural network, some long-term, short-term memory network, or you want to pick up on the transformers. Many of you have probably like interacted with that, or you want to pick up on some of the more recent ones as well, generative neural networks as well. Okay. Another step is then evaluation. So now you've trained your machine learning algorithm, everything is good, it seems to have learned, right? But you really want to tell, has it really learned? Many times, I mean, for example, back when you were like in high school or university, a way to actually tell if you've understood a course is by taking an assignment, a classwork, a test, or an exam. So also you want to expose your model to data it has not been trained on. Very similar to those ones as well. And you want to tell the ability of that model to really accurately or to be able to tell what the outcome exactly is, all right? And that's what we call evaluation. So basically you pass it through your model and then you say, tell me, does this person have cancer? Well, I think so, but I'm only about 60% sure. Okay, you're like, it's fine. As long as you're 60% sure, that is okay. That is what we call the confidence score. right? And there are so many ways you can evaluate a model depending on the field. For example, you could use accuracy. You could use some other things like your precision, your F1 score. You could use the perplexity, for example, when you're looking at natural language processing, and a whole lot of other metrics as well. In regression, you could be looking at your R squared, your mean squared error, and a whole lot of other metrics as well. Then, so you've trained your model, you've evaluated it. It doesn't seem to be doing so well. What do you want to do? You want to tune some hyperparameters, change some configuration there, like your activation functions, or basically the learning rate, and see if you can get to a better outcome. And if you're still not satisfied, well, you can collect more data, maybe try to like do better feature engineering, try to check that your data is really well annotated, or you could altogether just explore a different model. And lastly, so you have a question, but I don't even have data. How do I even start? Where do I even start from? There's a whole lot of public data sets that are available if you want to like do some applications in healthcare. You have the Centers for Disease Control and Prevention. You have the NHS. You have the World Health Organization as well. You also have the PhysioNet on some research databases. I will share the slide so you can actually explore. Some of the links also are also put somewhere in the references as well. There are some open data platforms as well, like your Kaggle, your Zindi, your UCI repository. There's a whole lot in UCI repository. I love it. You have your Google data set search as well to try to search if the problem you want to solve already, if the data already exists for that. Okay, just because we do not have a lot of time, so if you still, well, I would say in Mahatma Gandhi's word, be the change you wish to see in the world, right? So if there is no data, collect the data and share it with us. Or also volunteer to give data or volunteer to be part of that data collection process for some machine learning enthusiasts who already are trying to solve a particular problem. And on and all, just make sure that when you're collecting data or giving out data, ensure that the ethics are followed, right? Ensure that there's data privacy, and ensure that basically people are well informed of what the data is being used for. All right. We'll go to question and answers. Thank you very much.
Thank you so much, Jeremiah. Please let's give Jeremiah a round of applause. Let's leave our reactions for him in the chat. Jeremiah, this was a brilliant presentation, and in many ways, it really has been a capstone to what the entire series has been about, right? Because so Jeremiah took us through a recap of AI in healthcare, and then took us through the case studies, which was what he came to do today, but then showed us went ahead to give us a teaser of possibilities of things that we could think of doing, and of course an approach on how to go about it, which in many ways, you know, is very in line with what it was that we sought to do when we sought to organize this webinar. So there are reactions for you in the chat saying thank you. It was an impressive presentation. And just before we go into the Q&A, they're being curated right now. We want to remind ourselves what Jeremiah's presentation and really what all of this entire series means for us as healthcare professionals, because that's the majority of our audience. In many ways, we have come to learn that these AI technologies exist, and they are making a difference in the way healthcare is delivered, like in ophthalmology, resource planning, NCDs, infectious disease. We saw a lot more last week, but we also are reminded that there's a lot of individuals in our midst. We saw Prof last week, we're seeing Jeremiah today. These are Africans in Africa, you know, leading in the field. But also Jeremiah has reminded us that the big guns like Google and Pat and IBM are also actively working in this field. So you cannot go wrong, you know, by wanting to make a difference. And of course, a core part of his message was, let's try to be the solution, all right? Even the solutions that seem so far away and have been done in other places and, you know, seem just like, oh my God, just like magic. We we can be part of creating that solution in our communities. Let's go back to our communities. Let's look at the problems. Just look at our chats. We ourselves have been able to come up with things that we think that AI can do. And Jeremiah and our other presenters in many ways have shown us an approach on how to go about it. So we have a responsibility. We're not helpless. We need to be interested. We need to want to make a change in this. And at Digital Health Africa and Academic, we're hoping that we have been able to create some sort of that, of that start in our audience. So Jeremiah, we will take questions now. Our first question is from Maimuna. Maimuna has actually been she has been a regular with us because she can recognize her name. And she has two questions. So the first one is, on average, what is the accuracy of an AI model deployed for public use? Is there any threshold value we should respect? And her second question is, what is the main challenge you face in developing AI models? Probably, I think your AI models are. Over to you, Jeremiah.
Yeah, thank you very much. I was actually pondering on that question to say, what is the acceptable accuracy or performance? I would say there is no exact threshold. It really depends on what you are working on. For example, sometime 2017, we're working on a model that predicts when a patient may die. So more like the time to death. Now, the thing is, you want that model to be near accurate as much as possible. Otherwise, you're basically telling someone you're going to die in the next 2 months, whereas they actually probably have the next 10 years to live as well. Also, for example, you're trying to predict whether someone has HIV or not. Now, depending on the environment where that person is, if, for example, being HIV positive actually means being ostracized, it means you don't want to actually be careless with your prediction. So you want to go near 100% as much as you can, right? But then there are some other models that may not be too much consequential or may not really have a lot of heavyweight consequences. And for that, you may actually explore any accuracy level between 75. Well, I say 75 basically because, we don't have some even human performance even near that as well. So between 75 and 95, 100, if the consequence is not so much, I would say it might actually be a good one. Again, sometimes the data you have may only just give you the performance you have. There's nothing you can do about it. So if that actually is the case, you then want to actually really study more as to if that if what you're really analyzing is actually the best, or can you explore other features, or can you explore other models as well, right? And then the second question, which asks, so what challenges do we face? Already, like I mentioned, data collection is a major challenge, especially in Africa. I could remember back in 2017 when we were working on face recognition systems, it was way more accurate on European faces, or let me say generally light-skinned faces. And we wanted to gather data in Africa, but the question is, what do you want to use my face for, right? So basically, sometimes gathering the data can be a whole lot of challenge. And now talking about healthcare, right? There's a whole lot of gray area. An hospital wants to ask you, should we really give you this data? Can we really be sure that you're not going to maybe trace it back to someone? How do we ensure that someone's medical records are really kept safe, etc.? I would say really the data collection part is the most challenging part. For the machine learning engineer, like myself, I would say the modeling part is the easy part, really. When you have the data and you have someone with domain knowledge, you only just need that expertise of that domain expert and my knowledge in machine learning to really see how I can tune the model to give me my desired outcome. Hope that answers your question. And of course, again, another challenge is really deployment, right? Like I did mention, we've been working on views for some time, which is able to tell you up to 15 diseases or 15 health statuses. hypertension, diabetes, and a few other ones as well. But again, how do we really get this to the hospitals? How do we get the World Health Organization, for example, to sanction this, to say this is okay? And if it gives any wrong outcome, what is the legal consequence for that? Can we be held liable? Can we be sued for that? So I would say those are like major two challenges when we build production systems or production AI applications in healthcare. What answers your question?
Right. Thank you, Jeremiah. And thank you again for highlighting a challenge that healthcare professionals can solve in this whole AI revolution, because it shows that healthcare professionals have a key role to play, just including domain expertise as well. So let me just say to our audience that we do see the questions about webinar logistics, certificates, presentation slides. Let's just go through the technical questions with Jeremiah, and then afterwards we would have a little talk about all of those logistics. Okay, so let's just go to the next technical question. So Jeremiah, Mokadi is asking, what is the perspective of WHO on AI tools? Because he thinks that if WHO endorses it, then it would be easier to replicate in countries. So what is WHO's perspective on AI tools in healthcare?
The religious perspective.
No, WHO, sorry, World Health Organization.
Oh, okay, WHO.
The World
I
Health.
see. I see. So, generally, the world is slowly adopting artificial intelligence. Of course, it's the hype. But then, in reality, the world is accepting it more for like proof of concepts. Right now, and I would not necessarily say WHO alone, and this is basically because there is no official statement out there from WHO exactly about their perspective. But I would say many of these health organizations, there is the question, can we really trust artificial intelligence? There is something we actually call explainable artificial intelligence, and that is, can we understand how this AI model came about its decision? If we can understand, if it can tell us how it came about the decision, then it's easier for us to trust it more. But if it's just some deep neural networks that basically has a whole lot of layers, some complex layers, and abstracts many of its decisions, or they are not really much sensible to the human, to a human being, then it becomes difficult to really trust it, because the question is, what if at some point it becomes wrong, or it gives a wrong outcome? What happens? We could be putting someone's life in danger. So right now, the perspective more is, even if AI is going to be adopted, it needs to be supervised. But I would say we actually are having some good adoption rate of artificial intelligence, as long as it will be supervised. Hope that answers your question.
All right, thank you, Jeremiah. And maybe just permit me to add that at the level of WHO, there really has been a lot of work and talk in the field of AI in healthcare. I think they've put out a lot of literature in that field. Recently, there was the adoption of DHI, the Digital Health Monitor. There have been conferences. There's a whole division for AI and innovative medicine at WHO. So maybe just go to the website and look it up. And just like Jeremiah is saying, in general, these things may still be like proof of concept stage. But it's good to know that at the level of WHO, these conversations are happening. So they are not oblivious of it, right? So we'll take our next question from Umi. And Umi wants to know, are the data on the open repository you mentioned, are these data representative of African population and African health issues? What are the main challenges with health data in Africa?
So I would say there may be some, because we're having a whole lot of researchers that are actually working towards collecting data for Africa. There are a whole lot of organizations. You have the Deep Learning Indaba, the Masakani, the Data Science Africa, and a whole lot of these other organizations that are collecting Africa-specific data. Now, of course, many of the ones out there are not very much representative of the African demography. But again, that's a good opportunity, right? It basically means everyone right here can actually then look out for in their community and start collecting data. So to answer your question, I would say there's still the skew. And unfortunately, the reason for that is, one, there may be some cultural beliefs and maybe also mixed with religious beliefs as well in the African demography that may not make people be so willing to provide data for some system that may turn them against their cultural beliefs or God, for example. That is one. Another thing also is, unfortunately, in terms of like written data or in terms of like health data, text data or unstructured data, let me say, only in recent times have we started having people digitizing. So compared to some other countries in some other continents, Africa is a bit behind. But I would say again, if you are in machine learning communities or artificial intelligence communities, you would actually see that a whole lot of people have actually been collecting data for Africans. The only challenge we face right now is, should the data be made open source or should it be made proprietary? So right now, everyone is collecting data to build proprietary applications instead of like making some of this data open source so that like researchers can also train more on African data scenarios. Yeah.
Right, thank you, Jeremiah. I think Roslyn and Amas, your question has been answered. Your questions about challenges have been answered just because we're running out of time, because Jeremiah just covered those challenges. But then Jeremiah, there is a question about challenges related to funding by Dr. Ugushiwu, who is saying that they're working on a project for data collection in Nigeria for malaria diagnosis. Their challenge is funding. So is there any funding agency that can be of help to their research group?
So I do know that the Bill Gates and Melinda Foundation, I know they have a huge interest in malaria. So you may actually want to consider that. I know I was seeing a few grants as well. They closed, I think, sometime in May or sometime in April. But I can check if some of them may be open. And of course, you can feel free to connect with me as well on LinkedIn, and I'll be happy to send you some of those opportunities when they come by. There is not a lot of funding for social projects right now. Everyone wants AI to build something they can make money from. So if your healthcare is a whole lot around just research or a whole lot around social impact, without a strong value proposition around how to make money, you may not actually get money from, private investors and all. But what I would actually say, and find out to also commercialize these models or find some other way, even if you want to make it available to the poor masses, find some other way to utilize the data collected to still generate some sort of revenue. So I would really say you can check out even for World Health Organization as well. I know they do actually like not necessarily malaria specific, but then they would ask you for proposals or ideas around using artificial intelligence for healthcare. My company also does provide some little angel investment funding for AI applications. But again, like I did mention, there's not a whole lot of interest around AI for social impact without commercial value. Okay.
Wow, interesting.
But if you're working on something super cool, if you're working on something super cool and you think I really need to see it, please feel free to connect with me. Myself and my team would really look into it and we'll see if we can provide some little bit of funding. Right. Or probably also pull resources together and see people in our network to see if they can actually like invest in your projects.
Right. Thank you for
I'm
the
still busy. I've been busy.
Chris has also dropped the link in the chat. Please do take a look at that. He's saying you could also reach out to the Global Fund for funding. So if there's anyone just like Doctor who is interested in reaching this funding challenge, please take a look at the link that Chris has dropped in the chat. We are almost out of time, guys, so we're going to take just one last question and then go through the webinar logistics, and then we would have a closing remark from a representative of Academic. So just one last question, and this question is from David, who is asking Jeremiah, how do we ensure utilization of AI and implementation of digital health in interior parts of African countries where there are access barriers? How do we ensure that these AI solutions is getting to those people? Yeah.
Yeah, especially in the African context, I would say start looking more towards edge computing, IoT, and all. And the reason why I say that is a whole lot of people are building applications that really still need to connect to the server. But then, of course, you have places where there is probably limited internet or no internet at all, especially in some African countries. You can start looking at building models that don't really require that let me say that work offline. Basically, that is one. That is in terms of access. Now, I think more importantly than that is really sensitizing people about artificial intelligence, getting people to really ease into the adoption of artificial intelligence by them really understanding this concept, demystify the concept of AI. Tell them it's not some humanoid robot that really wants to shoot everyone, or that actually wants to create some disease that would actually destroy the world. Make them understand that there are some artificial intelligence concepts that can really be more beneficial, and they don't really have to be disastrous. So I would really say in terms of access, really, aside from offline or let me say edge computing, IoT computing, you really need a lot of funding to actually get some of these applications out there. But if you consider also embedded devices, small devices that may be affordable, you may actually find even better adoption in those rural areas. I really hope that answers your question. You need money for that, though.
Right. Thank you. Thank you. And so that's like the official close of the technical question session. And so in a bit, we would like 2 volunteers to please let us know in the comments, or you could speak up if you want. Would like to hear live feedback from you. Just tell us, especially if you've been through our previous 4 sessions, right? Just the impact that this has had on you, and especially what you expect from Digital Health Africa in the future. So while you mold your words, you could raise your hand if you want, and then we'll unmute you. While you mold your words, and we would just like to see a big official thank you to everyone who has been with us. This webinar series had over 950 registrants, and we have had over 85 attendees per session through all of these sessions. And that's so motivating to us to know that what we're doing, there's a community and there's an audience out there that is willing to engage with us. We would share a feedback. We are sharing a feedback link in the comments. You could click that as well and let us know your feedbacks. But right now, we would like 2 people from the audience to just raise your hand, please, and give us your feedback. Tell us how this webinar series has been, today's session, previous sessions, and what do you expect to see from us in the future? Please let us hear somebody's voice besides the speakers and the moderators. So you're welcome, Divya, who is thanking us for our efforts. And Divya is actually a name that we've been seeing over the course of this series. So thank you too for being with us throughout. You could leave a comment as feedback, or you could could just unmute and speak.
Hello, everyone. Thank you for the opportunity to attend this webinar. I think it was my first section, and I think I registered only for this one because I was curious to know the case application of AI in healthcare. And I really appreciate the different case studies that were shared. It's good to, as a medical practitioner, we've graduated from medicine school some years now, and things are changing. For me, it was important to be updated about these different AI application in the healthcare. I'm attending from Nottingham. I'm a Cameroonian medical doctor currently doing a master's of public health, global health in the UK. So I came here because I was invited, I think, by Glenys. She shared something like that, a link in the faculty of University of Buea Medical Doctors Group. And I was just curious to know AI application. Thank you to the presenter for taking us through the different AI application and the different technologies that have been evolving. For me, it was an insightful section, and it just sparked my curiosity about AI in medicine. Thank you for the opportunity, and I thank the presenter who took upon this initiative to not let the health professional from Africa to be behind, because many things are going ahead. I think it's an opportunity for us not to be left behind while this AI technology is going ahead. Thank you. Why? Yeah, thank you.
You're welcome, Onela, and thank you so much for honoring our invitation. Thanks a lot. We would have another feedback from Shepo. Shepo has actually been here for a number of sessions because the name is very familiar. So yeah, over to you, Shepo.
All right. Thank you, Glenys. And on a reflection note, I would like to say Digital Health Africa has actually, this webinar series has actually enhanced and strengthened my understanding of artificial intelligence and its impact in health. As a healthcare practitioner myself, I actually want to say this webinar series also has, because now I'm gonna start to apply what I've learned all in these 5 sessions. I'm gonna start now applying it in my hospital, in healthcare settings, and the links that have been shared are so useful and insightful. So I'm really grateful. You know, I'm running out of weight, but I'm really grateful for what this webinar series has actually given me. You know, the information that I gained from this whole series, it's actually overwhelming, and I'll just like to express my appreciation, and I'm very thankful for the organizers, for Digital Health Africa. I am very thankful.
You're welcome, Shepo. Of course, we are glad to hear that we are here to serve, and we hope to bring more of this to you guys in the future. So we are running out of time again, so we'll just have one last feedback from Chidiebere. Sorry, Musa, we're just going to go through the others. Or you could just, Musa, you could leave your comment in the chat, but let's hear what Chidiebere has to say since they raised their hand first.
Thank you very much for giving me the audience, and I appreciate everyone. Though I regretted ever not being here for the first time after hearing these things, I'm very, very, very much grateful, because in my society, my local, people are very afraid of technologies. People are very afraid to embrace the changes in our surroundings. But I thank this organization for seeing and finding the initiative, selecting the people that is very, very okay, like this, our presenter. I really respect you, sir, and I appreciate you for enlightening us and enlightening me. Because even if I want to talk to my people here, there are not like things that is backing me up are very few. But with only this one that I've learned today, I'll be more confident enough to talk to my people about this technology of a thing. So thank you very much. I appreciate a lot.
You're welcome, Chidiebere. So could everybody just take a minute, please, since our audience is very happy with us right now, please just take a minute and put in the chat what kind of programs will be valuable to you in the future? What kind of webinar series do you want to see from us? Please take a minute and put that in the chat. That's very important for us to know what to bring to you next. Please, we are taking note of that. Let us know what field. I mean, Digital Health Africa is really about digital health. So we're talking in the space of digital health. What do you expect to see from us? Programs, series. Please just put that so that we know what to bring to you and what will be valuable. And thank you so much, Rosalind. This is very thoughtful of you. We're very grateful that you have engaged with us so far. Yes, Shipo, we see that. Thank you. Thank you. We are noting what it is that you expect from us, and we will bring that to you in the future. So just to note, like we said earlier, all of the slides for all 5 sessions will be emailed to you via the email that you registered with. So we hope that that email is functional. You would receive them. There would also be certificates emailed to everybody who attended all 5 sessions. Is again via the email that you registered with. And please do not forget to go to YouTube to watch any of the sessions that you miss, because we promise you each of the 4 sessions before this one has been incredible. So, to get the whole picture of what it is that Digital Health Africa and Academic prepared for you, please go to Digital Health Africa on YouTube and you'll be able to watch each of the sessions. So please continue to put what it is that you expect from us as programs or as topics or, as content in the future. And in just a moment, we would invite Dr. Blessing from Academic. Academic is the organization that partnered with Digital Health Africa to make this webinar available to you. Dr. Blessing will be giving us a closing remark and also telling us a bit about Academic, because in many ways, the work that they're doing is answering some of the questions that have been asked over the course of the webinar series and some of the questions that have been asked today. So, yes, we do see your thank you in the chat and you are welcome. It warms our heart to see this. Please continue to let us know in the chat what it is that you expect from us. But right now, we will give the floor to Dr. Blessing from Academic to give us some remarks. Over to you, Blessing.
All right. Hi, everyone. My name is Blessing Obuokiri, and I'm a representative of Academic team. Academic is the African Canada Artificial Intelligence and Data Innovation Consortium. We have our nodes in 9 African countries. I'm the one representing Africa. Our headquarters is actually in Toronto, Canada at York University. And we have our main focus is basically to look at how we can generate African locally relevant data for Africa and use it to build models, solve African problems, solve African health problems, use it to predict diseases in Africa without needing to go into trying to get the data from what is happening in the global north, talking about America and Canada and the other Western world. So that is actually what we are doing. And on behalf of Academic, I want to thank you all for joining us for this impactful webinar series hosted by the Digital Health Africa in collaboration with the Academic team. And, we are incredibly grateful for your active participation and the valuable insights you have shared by that have been shared by our distinguished speakers, which most of them I know personally. And through us, they were able to put in their best in enlightening us in what they know about the digital health. So throughout this series, we have explored critical topics in digital health, from innovative technologies to challenges and opportunities in our field, especially in Africa. And your participation and contribution have also made this series a resounding success. And we hope and believe that the knowledge you have gained in these meetings will inspire you to actually drive a positive change in your work and in Africa at large. We are actually looking at a situation where you can begin to generate data, because actually when we talk about digital health, it's actually hovering around data. And if we begin to create data from the African context, the data that are really locally relevant in Africa, then we will begin to solve African peculiar problems. So as we progress, we want you to continue to build, continue on these kind of discussions, continue to foster collaborations and innovations. We are open to collaborate with any team or individual or school that are into that can be able to gather data or locally relevant data, so that we can actually partner with them to be able to build models that can solve African relevant problems. Or if you are a tech person that you feel you have skills that we can collaborate with in terms of building a method that can solve for African relevant problems, then feel free to continue to chat with us. I'm still gonna, I don't know, maybe I'll have to share our contact and my contact personally for those of you who may want to also go into academics. If you want to do masters in our team in academic here in Toronto, we have people from epidemiology, we have people from oncology, we have medical doctors, we have statisticians, we have mathematicians, and we're all working together to provide, to solve, to have a common goal. So it's more, it's very interdisciplinary. So we encourage you to stay connected with us for future events, and always, like our speaker just said, now you have to share your feedback, which also helps us to improve. What we are doing right now is stimulating and motivating you to see where research and innovations are going, and how you can actually come in. We have a lot of untapped data in Africa, and we need to actually make use of it. And that is one of the reasons why we're pushing this narrative and partnering with Digital Health Africa to make sure we bring this to your doorstep. So together, we can significantly impact the future of digital health in Africa. And I want to finally say thank you again, and we look forward to our combined journey together in bringing the digital health in solving African relevant problems with our own indigenous people. Thank you very much.
Yes, indeed. And thank you to Dr. Blessing for your continuous engagement and for Academics partnership that has been very instrumental. You could not have given better closing remarks, so I do not have anything more to say at this point because that was very well said. But just to encourage us to please fill the feedback form. And we could email that to you as well, but please fill the feedback form so that we're able to do better in the future. And like Dr. Blessing said, his contact and the contact of Academic as well will be shared to you with the slides. Please do follow Digital Health Africa on social media. Maybe could we have the slide that has our email and phone number, so that we stay connected, we stay inspired. This is just the beginning of a very long journey, and we hope that we have inspired you to start it or to keep on with what you're doing. Please drop your LinkedIn handles in the chat so that we can connect with one another outside of here. And from all of us, again, thank you very, very much. Look out for Digital Health. There will be more opportunities or webinars or something, based on the feedback that you have given us. We will be bringing something of value to you again in the future. Please drop your LinkedIn handles in the chat so that we connect outside of here. From all of us, thank you very much and have a great rest of your day.
Bye, everyone. Thank you.
Goodbye.
Oh,
Thank
I'm
you.
sorry. I forgot.
Bye,
I've just been
everybody.
reminded. Can we take a photo, please? Just before you go, please, that was my fault. Please do switch on your camera or put up an image on your profile so we can take a picture of attendees. Oh, this was my error. I'm so sorry. We should have taken this much earlier. I know, I'm sorry. I completely forgot. So please put up an image on your profile or switch on your video. take an image of attendees, please. Vivian, are you coordinating that? So please let me know when you take a picture.
Yeah,
Hello,
people
hi,
can also on
Vivi.
their own take a screenshot. Anybody?
Yeah, so you can
Yeah.
take a picture, you can just do cheese or just, give a
cheese and take a
sign, wave
screenshot.
your hands.
Yes, but it is. Yes. Thank you.
You have everything?
Do we have? Yes, just one more. And one more. Yes. Thank you, guys.
Do send me
Thank you.
do send me a screenshot of this photograph right now so that I can also post it on our handles. Or if you can post it as soon as possible so that you can tag us, we'll share it, please. Glennis, I'm talking
Okay,
to
this is noted, Dr. Blessing.
Okay, thank you.
Yes, absolutely. That's noted.
Bye, everyone.
Bye, everyone.
Okay.
See you
Bye,
next.
everyone.
Bye.
Bye. Bye.
Bye, everyone. Thank you for the opportunity.
Mm.
Wow. How is you about?
Okay.
Good evening.
Hmm? The end of the life.
Oh yeah, now the food. Oh, let's go and eat the food. Oh.
So you get your certificate in your email once we've sent the evaluation form to you and you filled it. We will send you your certificate as soon as possible. Thank you.